Today, psilocybin therapy, what the recent episode trial actually found, and what it means for treatment-resistant depression. Psilocybin is a serotonin 2A receptor agonist, a classic psychedelic that produces profound changes in perception and consciousness. Treatment-resistant depression affects millions who have tried multiple medications without adequate response. The episode trial, published in JAMA Psychiatry in May 2026, was a Phase 2b randomized controlled trial testing psilocybin for treatment-resistant depression. 144 adults with TRD were randomized to different doses of psilocybin or active placebo, with 2 doses given 6 weeks apart. The primary endpoint, treatment response at week 6, showed response rates of 17% for the 25 mg dose, 12.5% for the 5 mg dose, and 10.6% for placebo. Although this difference was not statistically significant, secondary outcomes showed clinically meaningful reductions in depression severity scores. Psilocybin's proposed mechanisms are distinct from conventional antidepressants. It works primarily through serotonin 2A receptor activation. When psilocybin binds to the 5-HT2A receptor, it triggers intracellular signaling that increases neuroplasticity, the brain's ability to form new connections. This neuroplasticity effect, including elevated brain-derived neurotrophic factor, or BDNF, may be central to its antidepressant action. Psilocybin also reduces connectivity in the default mode network, a brain network hyperactive in depression and linked to rumination. By disrupting DMN hyperconnectivity, psilocybin may temporarily shift cognitive patterns and break cycles of negative self-referential thinking. In the United States, psilocybin has received FDA Breakthrough Therapy designation for treatment-resistant depression, granted in 2018. Internationally, Australia has rescheduled psilocybin to Schedule 8, a controlled medicine, for treatment-resistant depression under specialist supervision. Critically, psilocybin is not a standalone treatment. It requires psychological support before, during, and after administration. The episode trial included 14 hours of preparatory and integrative psychotherapy, alongside each psilocybin session. Contraindications include psychotic disorders, certain cardiac conditions, and pregnancy. Patient selection is essential. The trial reported higher suicidal ideation on dosing days and 2 serious adverse reactions, including 1 case of hallucinogen persisting perception disorder. Clinical Pearl. Psilocybin is not an SSRI. It works through 5-HT2A agonism and neuroplasticity rather than serotonin reuptake inhibition. The evidence base includes 11 clinical trials, 6 open-label and 5 double-blind RCTs, with a pooled effect size around 0.66. Phase 3 trials are underway, and the field continues to refine dosing, session structure, and patient selection criteria. To summarize, psilocybin works through 5-HT2A agonism and neuroplasticity. Episode showed promising secondary but not primary endpoints. It requires psychotherapy, and regulatory pathways are evolving. For clinical learners, watch the episode trial space, understand the therapy component, and know the contraindications. Questions about today's content or topics you'd like to see covered in future episodes? Drop them in the comments below. And if you found this clinically useful, hit subscribe. More psychopharmacology breakdowns are coming. This video is for educational purposes only and is not a substitute for clinical judgment.